Did you send a link to our guest?
Yes, I did.
Okay, I just want to make sure. I don't want to assume anything. I never know with you.
Log on, I send the link because I don't want to send a link to one of your guests before you get on, because then him and I are just going to stare at each other.
You're going to talk to a stranger.
Right. We're just going to stare at each other, and he's going to say, well, where's Cooper? And I'm going to say, I don't know. I have no idea. When she gets on, it will be 10 minutes to figure out how to turn her mic up or down.
Turn her mic up and down, and then her chair is too low.
Then she's got to put a dog bed on her chair that she's sitting on so she can be higher. It's like a booster seat.
There's always some issue.
Yeah. So
it's never smooth. Yeah.
So if it's one of my people, like one of my guests, I got no problem talking to him until you log on. But if it's somebody you know, I got nothing to say to him. How's my eyes? I mean, that's the only thing I can say to him. You want to do me an exam now? Okay.
He can. They all the doctors do telemed.
Right. So that's probably what we were going to do until you logged on.
Right. You could just use his medical expertise and not pay him.
Right. Yeah, things I want to know, like eyeglasses. They're expensive.
Now if you get a Lens Crafters, that's where I got these.
Now they're expensive at his place. Let's say he's an eye doctor. Is he mad when I go to Lens Crafters and I say, give me a prescription so I can go somewhere else because you're too expensive and you have nothing for me to choose from?
Okay, so he's not an eye doctor. He's an eye surgeon.
But
so he'd be mad.
At one point
he'd be mad. No, he'd be mad if you went and had eye surgery from somebody on like Craigslist, like all those people that went and got butt injections from that woman in Chinatown.
But he doesn't have any glasses in his office.
No, he's not an eye doctor. He's a surgeon. He's an ophthalmologist. He's a professor of ophthalmology.
Right.
Okay. He's a surgeon at NYU Winthrop in Long Island, near where we used to live. Mm-hmm. And he's a professor.
He doesn't have glasses?
At New York Eye and Ear, Mount Sinai. Does
he have glasses in his office?
He has glasses on his face if you look at him. But no, not in his he's not an eye doctor. He's an eye surgeon. He's an expert. He's the next level up.
Can he write me a prescription for glasses?
I don't think that's what he does. I mean, they do.
I can
try.
Why
don't we ask him?
How about a prescription for Zoloft? Can he do that? Yes, we can hear you.
But you just froze up.
Oh no!
Dr. Gentile, let me ask you a very simple question. You and I have discussed you building a radio studio, and you have bought some fantastic equipment. Yeah. How come you don't use it when you get on with us?
It's called feedback. A lot of feedback.
Oh, so you haven't figured out how to use all your good equipment yet?
Actually, yes. So my little earpiece here works better than my $1,000 microphone. haven't figured it out yet.
Actually, no, it doesn't.
And the crazy thing is, guess what? I'm moving now, so I put everything together, never got it to work, and now I'm putting it back in the box.
Oh, great.
What am I going to do?
Am I going to have to fly up to New York and put your studio together?
Maybe I'll pick you up and drive you.
And if you don't have glasses in your office when I get there, I'm going to be pissed.
So it is. What's happened to ophthalmology is we've gotten very specialized. So we just do one thing and we do it very well.
Mm-hmm. Like you only do the right eye. If I have a problem with my left eye, I got to go to another guy.
The guy next door.
So there are specialists that only work on one eye. So.
So why are you moving to a new location?
I'm moving closer to decrease my commute. Yeah, my commute is a little bit too long. So I'm decreasing my commute.
So you don't care about your customers, your patients.
No, the opposite. He cares about his customers, so he wants his patients, so he wants to be closer to them.
Oh. Yeah.
He's moving where he lives, so he's closer to his patients.
Yeah. And the crazy thing is, you think that, COVID hit, everything would be a disaster. Mm-hmm. Actually, my commute was so easy. It gave me like a little bit of relief because there was no traffic. And now that the COVID is sort of ending, the commute is actually doubling. So it's actually perfect timing. I'm actually looking forward. I'm looking forward to it. It's going to give me more time to do some of my hobbies. And, there is a study that shows that the longer you commute, the less likely you are to exercise and stay healthy. I don't know if you guys...
The longer your commute, the less likely you are to exercise and stay healthy. That's interesting.
Yeah.
Because you don't have any time. That's my excuse. I have no time.
So how long is your commute?
It's like 20 minutes.
Okay, so if you decrease your commute by 10 minutes, you got 10 minutes to work out.
No, because Cooper would make me do something for that 20 minutes that I would save. So
no, and let me tell you, Dr. Gentile, when Anthony and I were roommates doing a radio show together, we lived within walking distance of the radio station. He never went to a gym, so it doesn't matter. He could live in a gym. No, he can live in a gym, and he still won't work out.
I went to a gym like 4 times
in 2 years.
I got the perfect solution for you, Anthony. One of those desks that you actually have to stand in and walk, and you can go and actually do your radio show while you're on your treadmill.
Yeah, that will sound really good. So,
how's your day?
Must lay down. Okay. No, that's not good at all.
We'd have to have more cardiologists on the show as guests.
Yeah, screw the eye doctors. We need the
we need cardiologists from now on.
Actually, we can have a Holter monitor connected to him. We can watch it and monitor pulse rate, and actually we can monitor your O2 sat at the same time.
Right.
So, were you taking a train into work?
Yeah, I was taking a train. But what's happened now is it's actually, the subway has gotten a little bit dangerous. And I just stopped taking, a lot of people have just stopped taking the train. Now, would I go back on? Yeah, I would consider it. But even the train ride is so it's the Long Island Railroad, which is an hour. And then you got the subway, which is another half hour to 45 minutes. So whichever way you cut it, you're talking about a long commute. Listen, I was getting a lot of work on the train, but again, It wasn't. You can't hit the level of concentration.
No, and also, I don't know if Anthony knows what's been going on lately on the Long Island Railroad is they've cut the amount of trains, which means trains are now crowded. There's more people, and people have been posting videos and photos of themselves standing room only on a train from, like, let's say Belmore to New York City, and it's like, hello, it's COVID, and we're literally on top of each other in a train now. Like, it's not like everybody there has been vaccinated yet. So, yeah, it's stupid.
Yeah, it's pretty scary. It gets a little scary.
Yeah, it gets a little scary. Well, Dr. Gentile, one of the reasons we want to invite you here today is because there's a trend on TikTok that I found very interesting. And I thought, you're the perfect person to talk about it because it's an eye thing that's going on. Anthony, is there any way you can pull it up and show Dr. Gentile what we're talking about?
Yep. So this is the new thing.
They look first at the camera. And you see the girl's got like whatever color eye she has. And then she turns to the side and does a side eye. And then the eye's a different color.
Yeah, that's fascinating. First of all, eye color has fascinated people through the ages. And eye color is a very interesting thing because there are about 8 genes that determine eye color. And the color of the eye is really determined by the pigmentation that's in the iris and the front of the eye. That phenomenon is actually interesting because what you're actually observing is if you look at the front of the eye, you can see some of the detail of the iris. But when you look from the side, you're looking through an optical aberration and you're only looking at one particular part of the eye that gives you that reflex and that color. One of the things I like about that challenge compared to all these other challenges is this is a relatively safe
challenge. It's not dangerous.
No, it's not dangerous. I mean, I actually
no one's drinking bleach. Yeah.
No one's drinking bleach. No one's drinking alcohol through their eye sockets.
Right.
No one's inhaling cinnamon and trying to kill themselves. So I like, this is a challenge that I think is fascinating. And I think it what I like children or kids to actually look at the natural world. So they're actually looking at the natural world and making observations. So making observations in the natural world, keeping them engaged. I think this is, to me, a healthy and a challenge that I actually think is great to have, as opposed to some of the other challenges.
That's true. So, okay, so the eye is not changing color. It's just an optical illusion, ironically.
So the thing is, if you ever look at someone's eye really close, sometimes you'll see there may be different colors in the same eye. Okay. Right? So if you look really close and you magnify it, right? So when you go to the ophthalmologist's office and you come to my office and we put you behind this microscope and we magnify the eyeball about 16 times, you'll see that the iris of the eye has multiple colors in it. And some people have more of it than others. And there's a thing called central heterochromia, where the pigment around the pupil is a different color than the pigment in the center of the iris. So when you take that angle and you look from the side, it's going to be highlighting some of the pigment in a different location.
I see.
Now, is it true that lighter shade of eyes like blue, and, that was light blue, when you walk outside, let's say there's snow on the ground and you go, that's really bright. Yeah. Does it matter if you have blue eyes or brown eyes, how bright something is?
Yeah, so remember, brown eyes, the darker the eye, the more it absorbs light, the less likely it is to scatter it. So people with brown eyes tend to have less glare than people with blue eyes.
Oh.
But it's not invariable. Right. So, but there are eye conditions out there that can cause problems with glare. So I'm not going to say, you have a glare issue or you're noticing this. An ophthalmologist really has to examine it and make sure there's nothing else that's causing that.
Got it.
Is it true that people with brown eyes are more full of poop?
I don't know. My wife thinks so, but I'm not sure.
My eyes are hazel. Okay, so don't even try it.
Yeah, she has green eyes. I have brown eyes, and she tells me that a lot.
So
that's right. My eyes are more green than brown.
So you're more full of poop than Cooper is.
If the poop meter, so it starts on the bottom there. Right, so Dr. Gentile is mostly full of poop, then me, and then Anthony Belize. So gauge this conversation based on that. All right, so the other thing that I wanted to ask you, every once in a while I check in with Dr. Gentile just because he's so fun to talk to. And this week I learned that you have very interesting experiences that it's funny, like when you think about anybody who deals with the general public, I mean, you have patients, but they are the general public. So you're going to run into people that are a little off, I guess is the best way to put it, or just different. And you've had quite a few lately. I'd love to hear a couple of those stories.
Well, in the service business, it's always challenging, and especially in practicing medicine, because people come in and they sort of react in different ways, and every person is different. What I find fascinating is you can take two separate people with the same diagnosis, but their response and how they react to how you speak to them is totally different, because their feelings about it are different than one patient has a different feeling about a diagnosis than another patient. And it's so-called my office staff, sometimes sees patients and they may use the term crazy. I never like to use that term.
Do they put it in the notes? Like when they hand you a folder, no. Is it like, watch out, here comes crazy? and is that in my folder?
Yes.
Listen,
that's the cover.
They don't do that. They may use those terms, but what I do is I try to explain to them as a physician, and it's very important, is that, if someone's not acting normal, you have to figure out why. And sometimes it's just, the fear that a patient has that they may be going blind, or they may be angry about something, or they may have had a bad day. I mean, the thing is, I give you an example. You're driving in traffic and all of a sudden, the guy behind you has road rage. And he goes in. Is that how he normally acts? I mean, is this his normal? Is that how does he act that way every day, every minute of the day? Probably not.
Anthony, yeah, pretty much.
Oh, Anthony does that? Okay.
Yeah, Anthony, pretty much.
So I'm sort of aware of, some of these outbursts. And the thing is, what you try to do is, and
you're being very kind. Once in a while, people come in and they're just schizophrenic.
Well, okay. So that's a different topic. Okay?
Oh my God, you've had that many. Okay.
Physicians have to be kind. I mean, if you're not a kind physician, then you're
in the wrong business.
Then you're in the wrong business, because otherwise, you really have to be able to put yourself in the shoes of the patient and really empathize with them. And I find that very important. Now, we've been trained, because there are cases when you talk about real mental illness, and this is sad, because there is mental illness out there, and it's, over 1% of the population does have issues with mental illness. So that's a little bit different dealing with that. So is that possible? Have I ever encountered that? Yes, I've encountered that in the office. And usually ophthalmologists, even though we're trained to deal with cases like that, it is probably one of the most stressful things you can encounter.
Like, give us an example. When did that happen?
Listen, sometimes you'll have patients that suffer from mental illness that may have a little bit of schizophrenia, and you'll have delusions of things that really don't make sense. So, for example, you're working in the ER, and the patient's complaining, and they're saying, "I have garbage and worms coming out of my eyes." And you're like, "Wait a second. Okay, let me." And I say, "Okay, let me take a look." No, this is real. There's worms and garbage coming out, and they're somewhat delusional, and I'm telling you, they really believe it.
So they're asking for an eye surgeon, but really they need a head doctor.
Yes. And the thing is, you go and ask other questions, and you try to figure this out.
So you check the eyes, and the eyes are fine, and there's no worms and garbage coming out of them. So then, I mean, do you have somebody that you call, do you have somebody on call that you can be like,
yeah, unfortunately,
come get this person?
Unfortunately, in a small ophthalmology practice that's not hospital based, we don't have that ability. But we do have social services we can contact, and we do have, we can contact their medical doctor if we suspect something. So there are things that we can reach out to. In a hospital setting, yes, of course, you can call the psychiatrist in that can deal with it. And I'll just tell you a little bit about schizophrenia, because it's interesting. When I was growing up and I was in high school, I had a very good friend, and he was an absolute genius. I mean, he was an athlete. He was a scholar. He would cite Shakespeare word for word. I mean, no one else could do this.
Anthony does it all the time. It's annoying.
Yeah, I nonstop do it.
He's like, to be or not to be. I'm like, oh, this again.
And what's interesting is he actually started at that time listening to rock music. He was into Black Sabbath. He started playing the guitar. He started playing around with some, smoking pot and, doing some drugs. And, it was getting a little bit worrisome. It was getting a little bit worried. And it was
because it was more than just normal. Because that sounds like everybody who grew up on Long Island.
Well, it started off normal, right? It started off, drinking beers in the park on a Friday night with your boombox, right? You remember that, Anthony? Boombox? It was that was, did you have something a little bit different?
Had one, still want one, would buy one now. Yeah.
And he ended up dropping out of school, and we thought it was related to drugs. We thought it was related to, outside influences. And it's interesting because when I went to medical school, I took a class in psychiatry, and a light bulb just went over my head and said to myself, wait a second. My good friend had a mental illness, and he was diagnosed with schizophrenia. And it's sad because, to tell you the truth, a lot of things we take for granted, right? We take for granted our vision,
right?
And, and we always I'm trying to save people from losing their vision. And guess what? Mental illness we take for granted.
But you were a kid. You couldn't have known. I mean, you can't diagnose.
I didn't know.
Yeah.
I didn't know.
I've told Anthony this story before, but I had this friend when I was growing up. I think everyone's had that friend when they were growing up that they just thought was just, your crazy friend or did like wacky stuff. And you didn't even really think about it. And now you look back and you're like, wow, that's some serious schizophrenia. I had a girlfriend who would just go into these fugue states. I mean, we just thought that she was just wacky. Like, she'd be normal and then she would suddenly just start talking in this gibberish language. And we would just laugh and think it was crazy. But like fun crazy, like, oh, there she goes again, kind of thing. And she used to scream the words that my friends and I still like say this to each other. She used to go, "Bacataquikas, bacataquikas," and she used to say that over and over, like it was a language, And remember, we were the MTV generation, so we were like always watching Beavis and Butthead. So we were like, "Oh, she's doing Beavis and Butthead," And then we would go into the movie theater, and like we would be sitting there in a movie theater, and it would be super quiet, and there'd be like some really intense scene going on, and she would just start yelling "Bacataquikas" in the middle of the movie theater. So we were, and like my friend Susan, poor Susan, was always the one that was like, "I'll take her out." She was like the mom of the group. So she would like take our friend out, and all these years later, it finally dawned on us, and we've discussed it amongst ourselves. And one of my friends is a psychiatrist. So we're like, wow, she was schizophrenic. She had mental illness. Yeah. And then we found out like a lot of people in her family did. Like we found out later on a lot more about the family that we did not know. But at the time, now I recognize the mother was a manic depressive. Like now I recognize those symptoms. Now we know what they are. It's part of our regular vocabulary. Yeah. But, back then it was just like, can't wait to go to her house. Don't know what's going to happen next. It was just like this adventure.
You're right. It's becoming more mainstream now. People are more aware.
Know they're more aware, but that's good because people are more willing to get help, or they're more willing to help somebody because they recognize it. I mean, we didn't recognize it back then. I wish I would have. Then I would have been like you, me, like hospital now, and that would have been that. Would have saved a lot of stress.
Yeah, sometimes when you're so close to that person, it's hard to see it, right? If you're in a relationship with the person, they're your friend.
Somebody yelling "Bacataquikas" in the middle of a movie theater, I think is a big red flag.
Well, I don't know. I mean, if you're out with your friends drinking and they're doing this, I mean, you sort of it's not going to come to the oh yeah, my friend. You're not a she to make that diagnosis, and you're not going to be asking the right questions. You just want to have fun.
We just think we just thought she was hilarious, but everyone else in the movie theater was like, your friend needs help.
Your friend is crazy. Yeah.
Yeah, your friend is crazy. Like people definitely recognize that. Yeah.
Take her straight to the doctor. I have a serious question for you.
Oh, no.
Do you own real clothes?
No, not anymore. No, I don't own real clothes anymore.
Or do you open up your closet
that's it.
and it's all scrubs?
This is my uniform.
So on Saturday when you go to Home Depot, do you put scrubs on?
Yeah. And then when I come home, I put them right in the wash.
And I put another set of scrubs on for my bedtime scrubs.
I have beautiful suits, fitted shirts, beautiful cufflinks, okay? Nice ties. Mm-hmm. Shoes you would die for, okay? I can't. COVID changed everything.
It's true. I could vouch for that because when I first met Dr. Gentile, it was when my eye basically exploded. And I walked in and he was wearing a fantastic suit. He was very well dressed. And I thought, I'm underdressed for this appointment. I'm going to come in a gown next time and have full hair and makeup done. What am I doing? I think I wore like just a regular plain shirt and just some jeans, with a nice pair of shoes, but still like jeans. How dare I? So I think once COVID is over, I'm going to get fully dressed up for my next appointment.
No.
But Anthony, listen, I get a lot of compliments too, because everyone thinks I look 10 years younger in this suit. Sorry, in this garb. When I wear my scrubs, they think I look younger.
Okay.
And it actually hides my bald spot, so I'm not going to blind you. Because you don't want to be blind in patients if you're an ophthalmologist.
Or maybe you do.
I think you go home and you open up your closet and you're like, this is my bedtime scrubs, my weekend scrubs, my workday scrubs, This is the scrubs I wear when I take my wife out for dinner.
These are my wedding scrubs if I have a fancy event.
This is my Nobu scrubs.
No one's complained about it. I have had no one complain about it. Actually, restaurants haven't said, wait a second, you need to wear a jacket. I'm like, what? I think
they're just happy you're there. They're just happy you're spending money.
The rules have been relaxed. Even the best restaurants allow you to go in.
Yeah, and see, that's how you get sad quickly. You walk right in. It's like, oh my God, he's a doctor. Let him in. You don't have to ask, is there a doctor in the house? You just got to look around. He's got to be a doctor.
Right. And in New York, we know he's been vaccinated, so he gets the best table.
Right.
Yeah. That's true. Well, listen, not all doctors are getting vaccinated, but they should. So I'm gonna tell you out there, we should all get vaccinated.
Yeah,
why would anybody not get vaccinated if they could?
Some people are scared. Some people are scared. You can't. Actually, no one is forced to get vaccinated. I feel it's my responsibility to do it. But there are people out there that are a little bit concerned. They may have an allergic reaction to a past vaccination, and they don't want to take the chance.
Okay, COVID's worse, especially long-term COVID and all the heart disease and things this isn't just like the flu and then you get over it. This is something that could affect you the rest of your life.
Mm-hmm.
I mean, I'm on all kinds of lists of end of the day vaccines. Like if there's a vaccination left, I get a call last minute and I can run in. I mean, I check my phone every night because I'm ready. I got my arm ready.
Are you on that list? Are you on it?
I'm on like 4 different lists.
Now, we know that wearing a mask helps block COVID. Now you hear glasses can block a little COVID. Is that true?
Yeah, that's true. That's true. Listen, some of the early reports, people had conjunctivitis related to COVID. The virus will end up on the conjunctiva and you'll end up with infection on the eye. So it is a possibility. Is it high risk? I mean, if you're working in an ICU where people are infected, you got to wear your eye protection. But if you're just walking around the street and you're keeping that 6-foot distance, the chances that you contract it through your eye is going to be relatively small.
But they are saying that anybody who wears glasses, whether it's sunglasses outside or glasses like we're wearing, they're less likely to get COVID for 2 reasons. One, because if somebody sneezes, the glass protects you. Yeah, but also, you're less likely to touch your eye.
Yes. Yeah, people, if you ever watch videos of people and what they naturally do, some people are constantly touching their face. I give you an example. Okay. I had about a couple of years ago, I had one of my relatives come to visit me in the hospital for an eye exam. Came for an eye exam. Mm-hmm. All right. And he left the hospital and, I gave him his full eye exam. And then a week later, he develops a conjunctivitis. And I'm thinking, I don't have any, no one else in my office had conjunctivitis.
Right.
There was no outbreak in my office. He must have touched something and touched his eye. Okay. And of course, I was observing him and that's what he does. And he got a really bad case of conjunctivitis. Okay. And guess what? He gave it to his spouse.
Oh, God.
Yeah.
So you should never touch your eyes, right? Never.
Well, listen, I'm not gonna say never, but if your hands have to be clean.
What if my eye itches and I do that?
Yeah, I know you're not really supposed to do that. You're really
not supposed to do that.
You're not supposed to do that.
What if my eye itches? How do I scratch my eye? Just
take a cool compress and you blot it. Don't rub it. Okay. And one of the reasons is because if your eye is itching, something's causing the itching.
Oh.
So then you're all you're doing is you're rubbing in that thing that's causing the itching. You're rubbing it in deeper, right? So imagine if you had a thorn on your skin.
Right. Right. That doesn't make any sense, right?
You're not going to be rubbing that in.
Wash my hands and then dab it or use some eye drops, whatever.
Yeah.
But if I rub my eyes really good, I can see Pink Floyd concert. And that's what I like doing. I like doing that. I can see, wow, look at the colors. So you're not supposed to do that?
Not supposed to do that.
That's not, no, you're not supposed to do that. You ever see those comic strips with Popeye the Sailor when he punches somebody and there's stars, around the head. Yeah, you're not. When you see stars, that's not good.
Oh,
that means that you're stimulating and mechanical trauma to the retina that's causing the nerves to fire. So you don't want to. You're pressing too hard on your eyes when you do that.
Wow.
No, it's a free Pink Floyd concert.
Saves him on all of his, doesn't buy drugs that way. Well, Dr. Gentile, thank you so much once again for your
welcome.
time. We always love talking to you.
Wow.
Thank you for your stories, Anthony. Stop rubbing your eyes. And thank you very much for joining us once again. We always love having you.
Hey, thanks a lot. Thanks for having me.
Sure, of course.
Yeah, go change into a suit now. Get comfortable.